So this might sound a little surprising, but up until maybe 10th grade, I wanted to be a teacher. But then, up until 10th grade, I realized that I didn't want to be a teacher at the same time. I volunteered at my church as a Sunday school teacher for preschool and kindergarten, and having little 2-year-olds, 3-year-olds, 4-year-olds, and 5-year-olds running around was not pleasant, especially when you were trying to teach them and they had no interest. Then I went and volunteered at a camp for middle schoolers, and let's just say it was fine up until 8th grade when, when you're in 8th grade, you're like, oh, I'm going to high school next year, and you think you're on top of the world, and I did not want to teach middle school either. Then I reached high school, and obviously, who wants to teach high school? So that's why I became interested in neonatology, because up until the ages from when you're born to about 2 years old, it's easier to work with them because they're willing to listen to you. And in neonatology, you focus more on babies and taking care of them, so you don't have to worry about them running around all over the place. So during the first 3 weeks of my research, when we were doing research assessments, I noticed a couple patterns. And in my first research assessment, it kind of gave me more of a description. And so throughout this presentation, I'll be talking about the overview, and I'll be talking about how that applies to me. So, starting off, there are 2 types of patients. There are the ones who are born prematurely, and they're the ones who have usually more complications. They're the ones who might have conditions of abnormal limbs. Their eye might be closed when they're born. They have irregular heartbeats. During my first mentor visit, I saw a baby whose kidney was in the front and was bulging and had a very thin layer, and her bladder was exposed. So there are many different conditions involved with premature babies. There are also the ones that are born maybe at a regular time or even at slightly later, and they have abnormal conditions as well, such as maybe a missing limb as well. So there are many different types, and there are different professionals that are in charge of it. Neonatology is a fairly young field. It's only 50 years old, and every single neonatologist I've spoken to has told me this. Because of this, there are many different ways to expand. There's so much research that needs to be done. There's different ways to improve and develop this field. In addition, there are different careers that are involved in order to make sure that this development is occurring in the neonatal field and as well with the babies that they are treating. So the first one is the neonatologist. This is the specific career that I'm focusing in on. In order to be a neonatologist, you have to be in school up until age 34. You have to first go through and get your bachelor's degree, and it does not necessarily have to be in science. It can be in anything as long as you get involved somewhere in the science fields. And a lot of the professionals I've spoken to, specifically Dr. Schneider, who is part of UT Southwestern, he pointed out that he strongly urged me not to major in science, and he majored in business, and he told me that because of that, he can establish better connections and network more. So you don't necessarily have to major in science to be a neonatologist. In addition, neonatologists are the ones who assess a baby's condition, and based on the lab results and based on physical appearances and temperature and their monitors, they decide what their condition is, and they're the ones who advise their staff how to treat them. Next, we have the neonatal nurse. This is the one who has a more hands-on approach to babies. They're the ones who read their monitors, they're the ones who record, they're the ones that feed them, they're the ones who comfort them when they cry. They have more interaction with the babies, and they're the ones that make sure that they're developing, and they report all of their information that they're gathering to the neonatologist so that they can make decisions. In addition, there are other careers that you would not necessarily associate with neonatology that are involved. There's the respiratory therapists, and these are the ones who make sure that the baby is receiving enough oxidation. They are making sure that the baby is breathing properly and that their lung function is working as well. There's also speech pathologists. Now, I know you think babies can't speak yet, but they focus more on the feeding aspects. Is a baby taking food well? Does this baby have any signs that they might not be able to eat normally in the future? Do they need a G-tube? Those kind of things. And they work very closely with the neonatologist as well to make sure that the neonatologist can prescribe certain medicines that can help the baby learn how to eat. Some babies are born with the ability to not swallow. They have a problem with that. So this is the person that advises the neonatology if they need to go through surgery to get this done, and those kind of things. There's also the dietitian who makes sure that the baby is receiving enough input to help them grow and develop, and it also makes sure that the output is good enough so that they can receive that their input is sufficient to support their growth. So when I was talking to Dr. Svani under UT Southwestern, he told me about the two types of neonatologists. And I think this is applicable in all the fields of medicine as well. There is the private practice and there's also the academic practice. In the private practice, usually neonatologists in the private practice work in groups such as the North Texas Perinatal Associates and the Pediatrics Medical Group. And these people are the ones who focus solely on taking care of babies. Their shifts are from 12 to 14 hours long, and they usually have very, very irregular work schedules. They have to work a certain amount of shifts per month in order to receive their pay and in order to be seen as a prestigious neonatologist. Then there's the academic side, the side that I'm more interested in focusing in. This side is the one where you are a neonatologist, but you're also this professor who's teaching residents, and you're also the one who's teaching neonatal fellows how to perform certain things, how to diagnose, how to be involved, and how to assess and learn the common symptoms. So in the academic world, your schedule's a lot more irregular. You have to work more frequently and for a lot longer. You have a very hard time to schedule certain activities because you have to make sure that the residents are learning. You have to make sure that your staff is working. As a neonatologist in the academic field, you also have to do research. As I said earlier, research is a crucial part in the neonatal field. So whenever you're doing this research, you're helping along the process of finding a good cure for things such as autism, and you're trying to find out better ways to see if a medicine is working or not in a baby, or if it's going to be harming them in the long run. So that's what the academic field is more about. And so how this applies to me is that I've learned throughout all my research assessments that it is constantly changing. Specifically in my first research assessment, the article that I was reading was talking so much about how there's so much developing, and because it is a fairly new field, as I said earlier, there are so many ways for things to change and to improve. And part of being a neonatologist is finding those ways and improving yourself so that you're treating a baby efficiently and making sure that they're growing, that they can be in a stable environment as well. In addition, it's extremely, extremely irregular. As I said, the academic field especially, because every single day is different. You have to make sure that you're providing enough knowledge and lessons to the residents and fellows in your neonatal field, but you also have to make sure that you're treating the babies you're in charge of well enough in addition. And teamwork is also a huge part of neonatology. You have to work with so many professionals and make sure that you establish good connections with them as well. It's not just the respiratory therapists, and it's not just dietitians. There's so much more, like cardiologists. You have to make sure that when you're treating a baby that you consult all these different professionals so that they have enough care and that they're growing as well as they can. It's also extremely busy. Most academic neonatologists have to work 6 out of the 7 days of the week. They have to get up at 5 a.m. and usually get home around 7 or 8. And so a lot of the professionals I've talked to, actually every single one of them have told me that the neonatal field does have a lot of sacrifices. You're required to spend a lot of time away from your family. You have to make sure that you find the right balance. You have to make sure that your family life is not being affected. And as hard as it is, these professionals are so respected and admired because of their ability to maintain their relationships with other people, balance their work, and in the academic field, do research and all of these things. It's also extremely challenging. As I said, neonatologists usually are in school up until age 34. And because of this, they have to make sacrifices, and they also have to constantly learn. They constantly have to be reading about the developments that are occurring in medicine articles. They also have to make sure that their research that they're using the research to develop new technologies that are able to read scans and labs, so that way they know that their baby is being cared for well enough, and that their machinery and their equipment is not the cause of any relapse. And my quote at the beginning of the year was that people never learn anything by being told, they have to find out for themselves. And in the past 2 or 3 weeks, I've been able to apply this quote so much. In the past couple of research interviews, and in the past mentor visit, and the past research assessments, I've learned so much, and I never would have been able to do that just on listening. But because of these research assessments, I've learned so much, and I'm looking very forward to being able to expand my knowledge and being able to progress more and learn more about how to properly take care of a baby. And as I explore this field, I look forward to being able to be a sufficient neonatologist that knows how to care for a baby efficiently. Thank you.